Well, hi everyone. It's Pete from the Pain Toolkit, and thanks very much for watching. Hey, listen, I've got a very good friend of mine, Professor Sam Ahmedzai, with me today. He's going to be talking to you about the importance of Prehab, in self-management. But Sam, can you just introduce yourself to the viewers and listeners?
Great. Thank you very much, Pete. And first of all, thank you very much for inviting me to take part in this. As you say, we go back a long way. So we've had lots of collaborations over the years. So I'm Sam Ahmedzai. I'm a retired professor of palliative medicine. I had the title of Emeritus Professor from the University of Sheffield. I worked for 20 years in palliative medicine in the hospitals. Prior to that, I'd worked for 9 years in a hospice. So I know quite a bit about palliative medicine, particularly in cancer, but also in other chronic conditions, particularly chronic pain conditions.
Okay. So Sam, listen, thanks very much for the intro. Listen, so this is the Prehab Pain Toolkit, and I think we're both recognise that people who get cancer, learning some self-management skills could be useful for, perhaps prior to treatment. I mean, can I just get your take on it?
Right. Well, first of all, I should say that thanks to you and your pain toolkit, you helped me get over my sciatica and back pain problem many years ago, which is why ever since then, Pete, all my patients get the lecture about self-management and referral to the pain toolkit.
Okay.
And as I said, most of my patients over the years have been with cancer of all different kinds, solid tumors, blood cancers, etc. And for them, my standard package was you've got to look at what you can do to help the surgeons and the oncologists do what they can do. And my role in palliative medicine was to help minimize pain, minimize side effects, etc. So I think the important message here is that if someone has a cancer diagnosis, immediately they go into a different gear. They're thinking, reevaluate their life and thinking of all the worst things. What we should understand is that cancer is now becoming a chronic disease for many people because the treatments are so good, Pete, whether it's the surgery, but the big advances have been in radiation treatment, radiotherapy, and in different kinds of drug treatment. So hormones, chemotherapy, immune therapy. So now we're seeing that cancer, which was initially very bad news, a death sentence, when I first entered into this profession 30 years ago, it's now becoming a chronic condition. And you know as well as I do that many chronic conditions are painful for various reasons.
Yeah.
One of the important things to realize is that pain in cancer patients has got many different causes. I mean, we always think about pain coming from the cancer, and sure enough, it does. Some cancers are not even painful at all. Actually, they're quite dangerous because if they don't have a pain, patients ignore it. You know, they've got nothing to go to the GP with.
Yeah.
So if you've got a pain and you go to the GP early, that's actually quite good. But as much as the cancer causing pain, the treatments cause pain. Whether it's surgery, we all know that surgery is painful, but there's studies which show that, say, patients after breast cancer treatment, surgery, or lung cancer surgery, they still have pain 2, 3, 4 years later. Not all of them, but enough to affect their lives in terms of recovery. Chemotherapy can cause pain in terms of neuropathy affecting the fingers, the hands, and the feet. Radiotherapy doesn't cause acute pain, but some patients, what we call cancer survivors, may start developing bone pains and joint pains 10 years later, because the radiotherapy that they got to this particular area starts to weaken the bones in that area. And sometimes they need joint replacement treatment. So we need to remember that the pain that cancer patients have is not just the cancer, but it's also the treatment. And there's a third group, Pete, and that is people, particularly, dare I say, like you and me, older people, that we have comorbidities. We've got other reasons to have pain. Low back pain, in my case, sciatica, but also it could be arthritis, it could be fibromyalgia, other conditions. So when we're thinking about someone going into cancer treatment, we've got to look at all the potential pains. And the simplest one to deal with first is that people need to optimize their previous pain. Whatever they've had before, make sure you've got that as fit as possible, as controlled as possible, maybe using medication, but we now know for chronic pains, we should not be using medications hardly at all, maybe for acute flare-ups, but not chronically.
Yeah.
Certainly don't go into surgery on large doses of pain medicines, because that's very problematic, particularly to get you off it afterwards. So it's sort of managing the pain using all the tricks of the pain toolkit that you teach and I've learned, to minimize pain as much as possible before you enter that surgical operation or other treatments. But the important thing is not just kind of, well, you talk a lot about exercise, you talk about sort of better movements. Stretching is really important.
Yeah.
And I'll tell you why. Because a lot of cancer surgery occurs in the upper part of the body. So breast cancer, for instance, lung cancer treatment surgery. And after the surgery, there's a lot of pain in the chest, in the shoulders, and often people get frozen shoulder because they're not able to move their shoulder. You must stretch, you must mobilize, particularly your upper body. Mm-hmm. Legs are obviously very important, walking every day, walking before your treatment, but it's very important to get your upper body as strong as possible to help you get out of bed and to get you back to normal after your surgical treatment. Another important thing that people can do is attention to their weight and their nutrition. Some people go into cancer really quite overweight, and we know that, for instance, ladies with breast cancer often are overweight, and that's a risk factor for having breast cancer. So the soon as we're diagnosing breast cancer, we advise patients to try to reduce their weight. Often there isn't enough time to reduce weight before the surgery starts, but you can carry on afterwards with weight reduction. It's known to be one of the biggest causes of cancer or cancer recurrence is too high a weight. But on the other hand, Pete, many people with cancer like lung cancer and bowel cancer, they've lost weight unintentionally. Yeah. And then it's really important to try and build up weight, and particularly not weight in terms of fat. That's not helpful. Muscle. You've got to build up muscle in your legs, upper body, your back muscles, because these things are the core strength that you've got. And that's a good way of raising weight, not by increasing fat. So, and one of the things I advise all my patients was anti-inflammatory diets. So things like containing a lot of omega-3 fatty acids. They're natural ways of reducing inflammation, which is what is a big scourge in cancer. So all these things matter. Exercise, stretching, weight reduction if you're overweight before cancer, or boosting up your muscle strength, and particularly paying attention to minimizing drugs before you go into treatment, because particularly, for instance, if you're going for surgery and you've got patches, ideally they should be reduced, if not stopped altogether. But if you are on a patch before you go into surgery, make sure you're still on the patch afterwards, because otherwise you could be a lot of problems with your pain control.
Okay. Well, Sam, I'll tell you what, loads of good information there, and I appreciate giving up the time to do this video with us. Listen, everyone, Sam's very well known in our field, in the pain world, with cancers and stuff like that. And for me, for those that may not know, I live with prostate cancer myself, and some of the stuff that Sam's told you today, I've taken on board, especially around stretching and exercising and stuff like that. I've changed what I eat now, etc. So. Hey, listen, I'm not Saint Peter. Like, sometimes I'm a bit of an naughty boy. I may have a bun or two from time to time, but on the whole, I've taken on a lot of Sam's suggestions and advice. So, Sam, thanks very much for today. I really appreciate your time. And don't forget, there's plenty more plenty of other videos within the Prehab Pain Toolkit to watch as well. So I hope you found this useful. Take care, and thanks very much for watching and listening. Bye.
Thank you very much, Pete. Thank you.